The honourable member from Werriwa.
By the Treasurer today that the impact of this change, the $5 billion increase in the co-payment and the prescription charges will have the impact of reducing doctors' visits by 1 million a year. It doesn't really give you a localised personal perspective on the nature of the issue. We can of course hear the member for Boothby today describing it as modest. We've had the Treasurer comparing it to beer and smokes. The member for Gilmore says it's just like a cup of coffee. And we can probably answer that with comments by credible sources, such as the AMA that said for practitioners, particularly those GPs providing care to patients in disadvantaged areas, the impact of the co-payment may make their practices unviable. Many patients in those areas will not be able to afford the co-payment and the GPs will not be able to charge it. Similarly, the Consumers Health Forum could note that the organisation is disappointed that the budget has not addressed underlying structural problems within the system, out-of-pocket costs and preventive and public health. So we've got on the one hand credible national organisations, on the other hand some parliamentarians who say it's all peanuts. I've got to say that in an electorate like Werriwa, where 96.2% of visits are bulk billed, the 7th highest rate in the nation, I've looked at the figure of 1 million today, and my estimate is that if you look at that level of bulk billing, if you look at the socio-economic characteristics, if you look at the reality that health problems are greater in poorer areas, then you've got to say the impact in Werriwa locally is going to be at least 10,000. That's a conservative estimate of people who are not going to go to doctors because of these changes. And I want to cite a local constituent that perhaps puts it in a personalised perspective. Dylan Tudor. Hi there, I'm a 21-year-old student. I live at home with mum and my stepfather. The GP contribution will be the worst thing about this budget. My mum works hard to make ends meet at home for me and my 2 brothers. And this $7 is just not affordable. When my 6-year-old brother needs to see a GP, mum is throwing away money that could contribute to groceries or bills. The financial situations of families are tough for most in Sydney. And just to make things better for mine, I've been saving to set up, starting amount $600, a fund for my mother, so when she is feeling the pinch, she has something to reach onto. Good to know she will have to eventually throw most of that lot away for something that should be free. That's the real impact locally. And if we cite the statistics in this country, we note that the Family Medical Research Centre at the Sydney School of Public Health noted that even before this change, in 2012-3, 5.8% either delayed or did not see a doctor because of the existing cost structure. That's before we even go down this road, a road that the Treasurer says will lead to $1 million less visits. And when that Reliable Research Institute noted that, they said that a larger price signal than that is suggested in the media will arise. They noted that their figures were probably an underestimate for a number of reasons, including the fact that 1/4 of consultations for people over 16 years of age actually led to $14 2 visits. They also noted the additional cost of other than GP hospital pathology. We don't need to look at that Reliable Institute, but the Health Communities study showed in 2011-12 that in the Medicare local units in this country, the rate was between 1 to a high of 13% of visits were called off or delayed because of the then existing cost structure. 15% were the number of prescriptions were not utilised because of a cost structure. And I want to say that the scare campaign that we've got to be alarmed at the level of cost in this country also has to be answered. As a percentage of GDP, Australian government spending on health is the 10th lowest of 33 countries in the OECD database and the lowest among wealthy countries. What we've got here is a scare campaign which is designed not to make Medicare sufficient, not to save it, but to actually destroy it. And that's shown by the fashion in which earlier speakers have noted, doctors who will basically be $14 out of pocket if they maintain bulk billing. It's designed to persuade doctors to abandon the system. It's designed to make sure it doesn't exist. We have a situation where if we compare this to the United States, the system they aspire towards, 8.3% of GDP spent by that government, higher than the 6.4% spent by Commonwealth and state governments in this country. This is very clearly going to lead to the further impoverishment of people. It's going to lead to them not attending doctors when they should be there.
Time has expired, and I call the member for Lyme.